When we look at supporting patients with PCOS, we look at the symptoms and we can divide them into two different categories: symptoms that are external, symptoms that are internal. And both of these types of symptoms can often be driven by a group of common factors. Two very prominent pathophysiological factors that can drive a lot of symptoms of PCOS are insulin resistance and chronic low-grade inflammation. Both of these issues can cause things like hyperandrogenism, weight gain. They can affect your cycle regularity. They could affect things like implantation and even miscarriage risk. So PCOS related symptoms, while they can manifest very differently for each individual patient, some of the underlying issues can have a lot of similarity. So when we're looking at treatments to support PCOS, we're usually looking at treatments that will help address this low-grade inflammation or insulin resistance. So we're seeing research that applies something called low-level laser acupuncture, and they'll actually use this acupuncture and target specific nerves that will innervate the ovary. And we know that this laser seems to have an impact in reducing inflammation. So what they're seeing in clinical studies where they're applying laser acupuncture for the treatment of PCOS is that they see an improvement in ovulatory function, they see an improvement in endocrine profile, so improved hormone parameters, and they see improved metabolic health as well, mainly improved insulin sensitivity. So we're seeing how laser acupuncture, by reducing inflammation, may actually have a role in supporting other symptoms of PCOS. And one of the wonderful things about the laser acupuncture is that they often found it could be applied in conjunction with other treatments. So for example, diet and lifestyle recommendations. Researchers even suggested that it could be used in conjunction with conventional medicine to support ovulatory function and induce ovulation as well. So laser acupuncture might be one of those low risk of harm and potentially beneficial treatments that could help support a more holistic approach to managing and treating PCOS.